It is Tuesday, April 20th. And welcome to the Kahnawà COVID-19 Task Force update. This is our 204th, and today we have some important news, lots of developments, so we're not going to waste any time. We'll get right to it, and we'll start things off with the Executive Director of the Kahnawà Memorial Hospital Centre, Lisa Westaway.
Good afternoon. So we've put out a communique recently, and we'd like to advise the community that there has been an identified positive COVID-19 case at KMHC on inpatient. So this is an employee, not a resident. And I would like to clarify that this is not an outbreak, as it is one singular case. And this is also not a lockdown of KMHC. So the Kahnawà Memorial Hospital is not in lockdown. It's really important that we clarify this. We have one case on inpatient. The rest of the hospital is not impacted, and it happens to be 7 residents who are considered contacts and who are presently in isolation. So normally, basically, the measures that we implement are preventative in nature, and they are, it's with extreme caution that we put these measures in place because of the variants. So what we do know is that over the course of the last little while, there have been community members exposed to variants, and so therefore we know that variants are circulating greatly amongst us or within the different communities around us. And therefore, it's important that we take extreme caution. The public health measures have been increased over the past month in order to reflect this change in strategy to try to reduce transmission of COVID cases, especially in the face of the variants and in the face of the fact that we don't have a lot of information about the variants and about vaccine efficacy against the variants. So as of today, all 7 residents are in isolation. They're also all being tested. And once we have results from those tests, it will give us a little bit more information about procedures as we move forward. As you know, we had increased visitation on inpatient, both long-term care and short-term care. So all visitation is presently on hold on our 2nd floor. And again, all of those natural caregivers are still continuing their work with their loved ones as they were offering a service. So that continues. Our local public health team has completed contact tracing, and again, we will be providing you with more information as we get it. The hospital is still open. It's really important that you continue to come to your appointments. We don't want to have other medical situations because people are not coming into the hospital. So this is really important. The hospital is safe. There is a case, and this is not surprising. So as you know, on Friday we released information about a positive case at KSCS. We have a positive case at KMHC today. We have other contacts of cases from people in our surrounding communities. And so what this tells us is that we are not out of the woods yet. We have been talking about this for a little while. COVID-19 still exists. It is still a risk. It is more of a risk because of the variants. However, we have our utmost protection. And that's where this is leading to, is for me to give you an update about our vaccination process, which is the good news. And again, it's not in vain. Vaccines are important. They're important part of the process of getting through this pandemic, and therefore we want to continue to encourage those who have not been vaccinated to get vaccinated, and we'll tell you how in a short little while. So our vaccination campaign is completed for first doses at the bingo hall, and I want to give you just a little bit of a summary. So in total, we have provided 5,014 vaccines. That's a huge number, and it's really exciting in a very short period of time. Some of these vaccines were given to residents at the end of December, early January, and they're included in these numbers, but the total number is 5,014. So the total number of 16 people, 16 plus from the community are 3,872. This is 74% of our population that are eligible, 16 plus. Of course, this is a really great news. It's wonderful. It offers us that extra level of protection, and we wait for more details about how this protection can work against the variants in order to be able to make decisions as a task force for how we move forward in the coming months. But the next couple of months are really important for us to be going through life with extreme caution, distance, hygiene, mask, vaccination, well-being. We keep adding words to our list, but that's our arsenal. That's how we have control over this virus, and that's how we have control within our day-to-day lives, is by keeping these measures in place. So we actually have also had the benefit of vaccinating some community members with second doses. A total of 651 people have received second doses. Some of these second doses went to our most vulnerable, immunocompromised. Some are elderly. Some are our healthcare workers that were actually eligible at the 112-day mark or 16-week interval for second doses. And so we're really happy to have been able to do that at this time for a small proportion of community members, considering that Quebec's interval schedule is still at 16 weeks. So for those who did not receive their second dose, many of you are calling the hospital or calling the task force to ask for your second dose. So we just want to make it clear that second doses are not available at the present time. The task force, as well as many political bodies, continue to negotiate to have second doses more quickly for the community. However, at the present time, we still are at a 16-week interval. So that brings our next vaccination clinic to mid-June. Many of you have your second appointment already scheduled, so we'll be providing you with more information regarding that as the weeks go by, but that appointment needs to be maintained for the present time. Those who do not have a second dose appointment already scheduled, we will be reaching out to you in the coming weeks. But again, just keep in mind that we're only doing second doses right now, mid-June. For those people who still want to get a first dose of the vaccine, it's okay if you've changed your mind. We now have a process in place so that we can vaccinate you if you're interested. So there are several different ways that you can go about this. The first is through the pharmacy. So for a very short period of time, the pharmacy on the Old Malone Highway does have Moderna vaccines available. You can contact them directly and they will arrange for you to get an appointment to be vaccinated. And otherwise, you can contact the Public Safety Unit at 450-632-0635 and leave your name and number. And that information will be provided to Kahnawà Memorial Hospital, where we'll compile it and make arrangements to vaccinate those people who are interested. And so it's really important that you call and leave your name and phone number so that we can make those arrangements for you. Next vaccination is happening for KMHC inpatient, and that is scheduled for next week. We will get an exact date shortly following Moderna delivery on Friday. And so we'll, of course, keep you posted about that, and we're obviously very anxious for our residents to have their second dose. I think that's it for me today. Just a reminder that testing is still existing here at the Kahnawà Memorial Hospital. Very important that if you have COVID-related symptoms, that you call to be tested. So if you've had one vaccine dose, you still can get COVID. Some people are having less symptoms, so they're less symptomatic having had one dose of the vaccine, and therefore you might just have a slight headache, a runny nose. It's really important that if you call and you make a request to be tested if you have any COVID-related symptoms, so that we can rule out COVID. We have to, again, assume that if we're not well, that we do have COVID until a test tells us otherwise. Remember, testing allows us to control the virus within the community. We have many people in isolation who are contacts of positive cases, so we see the potential of this expanding or really widening. We want to keep our numbers low. We do expect to still have COVID, but we want to try to limit transmission as much as possible. So by being tested when you have symptoms, you're doing your part. So thank you for following through on that. Thanks.
Thank you very much, Lisa. Lots on the docket there today. And, well, we'll continue because Lisa Lahache will be joining us, and she's here for the first time. She works at Kahnawà, again, has community services. She is the team leader for communications and public relations, and she has an update for us. Lisa, welcome.
Good afternoon. As Joe mentioned, my name is Lisa Lahache. I am the team leader of communications and public relations at KSCS, and I'm here this afternoon to give you an update on our food services. So the Orville Stand-Up Memorial Cattery Food Basket and KSCS Emergency Food Basket announced this week that starting on May 7th, 2021, that's a Friday, food basket deliveries will be moved to a monthly delivery for all of our recipients. Emergency food basket recipients can expect a written notice and a phone call to inform them of the new schedule. The change was made to address the availability of staff to administer the service and to ensure that we would have a budget to sustain this program indefinitely. KSCS and the Cattery Food Basket have been offering bi-weekly and monthly deliveries since March of 2020 to families in need, and we plan on sustaining this service for as long as is required throughout the COVID-19 pandemic. We would like to remind food basket recipients that you should be home on the day you expect delivery, and if you miss your delivery, you can always call KSCS main office 450-632-6880 and request to speak to the emergency food intake services. Thank you.
Nice work there, Lisa. Joining us, our final presenter on today's update is the Commissioner of Public Safety, Lloyd Phillips. Lloyd.
Thank you, Lisa, and Lisa, for a lot of information for the community and a lot of vital information because, again, things continue to evolve in the community. And, again, we're here to commit to the community to give as much information as we possibly can. Just a few points I want to cover this afternoon. I'll be fairly brief. First point is I want to relay to the community. I personally did go out yesterday that there was an extension granted to the state of emergency, which was requested and supported by consensus by council this past Monday. And so the state of emergency has been extended up until May 21st. Actually, tomorrow marks the 1-year date of state of emergency. So as of tomorrow, we're officially but unfortunately under a state of emergency for 1 full year. But prior to that, we did have a declaration of a public health emergency, which kicked off the task force. It kicked off all the measures in place, but then it was later upgraded to a full state of emergency. So that's just a tidbit of information. But also, as you recall, there was measures that were changed within the law, modifications, amendments made to the emergency preparedness law, which allows for us to move out of a state of emergency into a recovery phase with still maintaining certain mandates for the task force. But unfortunately, the situation we are in as we speak today did not feel appropriate to exit the state of emergency at this point. That's why the recommendation was made and supported. And I think some of the comments and some of the information that Lisa just relayed to you, kind of reinforce the fact that we have to, remain vigilant and be very cautious and as things progress around us. Yeah, speaking of that, today, again, as he does often, Premier of Quebec, Legault, had a press conference and talked about the overall situation in the province of Quebec, extending the lockdown in several areas within the Quebec region, which proves again that the variants are taking hold and are a major concern in many areas. They did specify Montreal, the greater Montreal area, as being critical but stable for the time being, which is a good thing. Geographically, we are within the greater Montreal area, so we have to be very mindful of that. Even though, as we said many times, Kahnawà, we've been doing very well. We've been maintaining, the measures in the community, being very stable despite, a few incidents in the past couple of weeks. We are still in very good position. Things are still going very well, but that's only thanks to the hard work of many people involved at the task force, at community level, education level, and of course, obviously, community as a whole. And so we have to maintain our caution. We have to maintain our safety because, again, there still are many of those unknown elements regarding the variants that unfortunately is something we all don't really want to talk about, but that's something that has become more and more prevalent in the past month and a half. And it's a reality we have to deal with. We have to persevere and find a way to continue what we're doing, to keep our community safe. As well, the situation in Ontario is continuing to decline or escalate, depends on how you want to look at it. Decline in terms of being bad, escalate in terms of number of cases, and they are basically going to a near full lockdown as they've been for a while, and that's going to be continuing for a while. And Ontario actually even called out for assistance to other provinces for vaccines and for healthcare workers and such. So again, the situation around us unfortunately continues to deteriorate. Within the greater Montreal area, the situation again remains critical, and so unfortunately we don't foresee any nurses or healthcare workers leaving the province to go assist in Ontario because again, with the length of the pandemic, people being stressed and people being tired, the healthcare system is being strained, and the last thing we need to do is put more pressure on that by having people leaving the province and going to help other places. Even though you may want to, it's something that certainly cannot be done at this point in time. So I raise that just as a point for people to consider in the bigger picture of where we are. In Kahnawà, I said it before that we have a way to see ourselves through this pandemic, this big third wave that's coming down on us, so that we could weather the storm fairly well if we stay vigilant. But at the same time, we are not an island on ourselves. We are surrounded by a whole bunch of red. So let's hang in there a little while longer. We will find a way to persevere, and we will get this through together. So now I'll go talk to you soon.
And thank you very much, Lloyd. Just a couple of housekeeping notes, so to speak. Lisa was mentioning 74% of those 16 and over were eligible to receive the vaccine in Kahnawà. That's a great number. We were aiming for 80, if you recall, at the beginning, and we're getting pretty close to that because people are still being vaccinated. So good work to the people here in Kahnawà. One other note, that our next program will be coming up this Thursday, 2 days from now. But after that, we will be going once a week, and that will be on Thursdays. However, as we've said all along, should the need arise, we will have a special broadcast of the update from the COVID-19 task force as needed. But after this Thursday, it'll be every Thursday for as long as we need to do this program. And final note, I'd like to say happy birthday to our good friend Ajeza. He's enjoying some Toto's Pizza. He's going all out today, so happy birthday. He's done a great job over at the bingo hall getting the facilities in order for the vaccinations. So that's it for today. I'd like to thank Lisa, and the Cult Jam. I guess that makes Lloyd the Cult Jam. So, and thank you all for watching today. I know we had a lot on the plate, so thank you for watching, and we shall see you on Thursday. My thanks to David Lahache for filling in for the last 5 or 6 weeks. We'll see you next time. Yao ko nano honigiwahi.